Hello, I am Dr. Ansmani, and this is the second of the series of videos on biostatistics and research in medical science, coming under the subject preventive and social medicine. Similar sessions in concept bridge and postgraduate coaching can be found out in youtube.com/acpgmed. Please visit the site frequently. You can also have an account in the facebook.com/acpgmed and make it a friend. Please visit the channel youtube.com/acpgmed regularly. And this is actually the continuation of the series, and we stopped with the epidemics, and the third part is the common source epidemic, point source epidemic, and propagative progress epidemic. In common source epidemic, all susceptible individuals are exposed to a specific infectious pathogen or noxious agent like chemical pollutant or heat originating from a usual, conventional, or customary source, that is common source. The mode of transmission is termed indirect because of the evidence that the pathogen or agent is vehicle-borne, contacted through fomite, wood, water, or air, and because secondary host-to-host direct transmission is rare. By examining the shape of the epidemic curve, it can be seen that the fewest number of cases become apparent after a minimum incubation period, and the largest number peaks at the end of the usual incubation period from the point of exposure to the midline of the curve, creating the typical unimodal shape of the common source epidemic curve. The common source epidemic curve is shown here. Minimum incubation period A plus B, usual incubation period, common source epidemic, the exposure time A, B, the curve, vertical axis the number of cases, and the time in the horizontal axis. Although common source epidemic may involve only one incubation period of an organism, repeated or prolonged population exposure to the common source often involves infection by a pathogen over the course of more than one incubation period, producing a wide peak or apex in the common source curve. I already told about the infectious hepatitis A in the previous video about the transmitted by food handle or restaurant or water contaminated with Vibrio cholera at a local lake. Point source epidemic also we covered. In a point source epidemic, all susceptible individuals are exposed to a specific pathogen at one point in time. Point source epidemics are essentially subcategory of the common source epidemic, in which a common source to the offending pathogen or agent is both brief and simultaneous. As can be seen in the point source epidemic curve, there is a very explosive increase in the number of cases over a short period of time after exposure to the noxious agent. Because the temporal aspect of the curve involves only one incubation period of the offending pathogen, apex is much sharper. Decline in the number of cases is more rapid than in a typical common source curve. As with common source epidemic as a whole, secondary transmission is rarely seen in point source epidemic. For example, after eating dinner at a wedding reception, I already told, some guests developed food poisoning. Propagative epidemic. In propagative or progressive or serial transmission epidemic, the pathogen is transmitted from person to person. The mode of transmission may be direct, in which the transfer of infectious agent is through direct human contact like genital, anal, oral, and skin contact. Directly aerosolized respiratory droplet, fungi, bacterial spore, or parasite. Or indirect contact, in which the pathogen is either vector-borne like arthropod or airborne like a dried droplet, residue, and dust. In direct transmission, susceptibility to secondary infection is dependent upon the proximity of an individual to a contagious host as well as to the portal of entry, pathogenicity, and dosage of the infecting organism. Individual immunogenicity and herd immunity also play very important role in propagative, that is person to person disease transmission. The curve for the propagative epidemic shows an initial rise in the number of cases that is less explosive than in a point source epidemic, and successive generations of secondary infections produce a polymodal distribution conforming to several generations of incubation period. The figure is shown number of cases in the vertical axis, time in the horizontal axis, and the propagative epidemic or the progressive epidemic is shown by different peaks, which rises in the early phase and then comes down in the later part of the time. Example of propagative epidemic. Classical example of propagative epidemic is measles transmission in school children. Among the many other examples are outbreaks of viral hepatitis, influenza, and sexually transmitted diseases. Examples of vector-borne indirect human-to-human transmission include malaria and yellow fever. Note that although the shape of an epidemic curve may often help us to distinguish between common source, point source, and propagative or progressive epidemic, several factors can make these distinctions very difficult. Repeated or prolonged exposure to a common source, recontamination of the common source, multiple incubation period, long incubation period, and the uncommon occurrence of secondary infection may all create a bi or polymodal distribution and obscure the typical unimodal shape of a common or point source epidemic curve. Conversely, short incubation period as are seen in propagative epidemics like influenza can introduce temporal relationship into the curve that are very similar to those of a point source epidemic. When such complications exist, a classification of the epidemic cannot be based solely upon the shape of the epidemic curve. Further investigation often involves a vectorial analysis of the geographic distribution of the outbreak to facilitate accurate classification. Attack rate. When a point source epidemic involves the occurrence of food poisoning, an identification of the specific food source or vehicle that is transmitted, the infecting pathogen is made by comparing the attack rate between people who ate specific food and those who did not. Similarly, when an outbreak of hepatitis A, that is a common source epidemic, or measles like propagative epidemic occurs, primary and secondary attack rates are computed for specific periods to determine the incidence of disease during these periods. When incidence rates are calculated for populations that are at risk for only a limited time, which may be weeks, months, or duration of an epidemic lasting less than 1 year, they are commonly referred to as attack rate. The equation is attack rate is equal to number of new cases during a specific period by number of people at risk during the same period. Attack rate example is the given below. During the month of November, a measles outbreak in an elementary school caused absence of 100 of its 400 children. During the month of December, an additional 100 children were diagnosed with measles, as were 150 of the 200 brothers and sisters of the first 100 children. Find out the attack rate of measles for students during the month of December and the secondary attack rate for the siblings. Always remember to reduce the number of people at risk by the number of people who are no longer at risk during the specified period. So, that's the answer. Attack rate is equal to number of new cases during a specified period divided by number of people at risk during the same period. So, 100 by 400 minus 100, that is 100 by 300, 33%. And secondary attack rate is the 150 children we already said, and 200 remaining, 150 by 200, 75%. So, we have to reduce the number of people at risk by the number of people who are no longer at risk during the specified period. That's how the number 200 came. Shortly after an annual day party, staff of company came back to their rooms, and most of them, that is 62 out of 74, experienced vomiting and diarrhea. This epidemic may be classified as which one? Point source, propagative, common source, serial, and direct. The answer is point source. The third question. 10 days after a measles outbreak in a small town, several elementary school children became symptomatic. Subsequently, Additional cases were found among friends and families of the infected students. This epidemic may be classified as point source, propagative, common source, indirect, and vector-borne. What's the answer? Propagative. Fourth question. After returning home from a family planning clinic, Dr. XYZ noticed a slight itching between his fingers. Within 2 days, his wife had similar itching, as did his son 1 day later. This epidemic of scabies may be classified as point source, indirect transmission, common source, serial transmission, or vehicle-borne transmission. What's the answer? It is a serial transmission. Hope that the session was useful to you. The next session will be on the 2x2 table and its concepts. Goodbye from ACPGMet. Please visit the channel youtube.com/ACPGMet. You can see similar practice sessions on concept bridge and also postgraduate entrance test. Thank you.